All right, well, let's get going. So, welcome everybody to the 2026 Open Enrollment Benefits Overview. I'm Margot Simpson, Director of Global Benefits for Brand Safeway, and today I'm going to be walking you through your benefit options and helping you make informed decisions for the upcoming year. Now, this session is designed for all salaried and support employees, as well as employees in California and Hawaii. During this session, we're going to go over the basics of open enrollment, give you an overview of our benefits offerings, and talk about what's changing for 2026. Now, if you have questions, please feel free to send those in the chat throughout the presentation. Just remember, the chat is viewable by everyone, so if it's a private health matter, don't send that in the chat. Please reach out to one of us afterwards or open up a Workday help case. So here are the biggest things to know. Open enrollment runs from October 30th through November 14th this year. It's an active enrollment, which means you have to complete your enrollment and actively elect coverage in order to have benefits in 2026. Your benefits will not automatically roll over from 2025. Now, during this enrollment window, you'll enroll online at brandsafewaybenefits.com. Now, in order to be eligible for coverage next year, you must be a full-time employee who works at least 30 hours per week. You can also enroll your legal spouse, children up to the age of 26, and disabled dependents. As a note, domestic partner coverage is only available for Kaiser enrollees in California. Like I mentioned, this year we have an active enrollment. That means that your benefits do not roll over automatically, and you must take action to enroll or waive coverage. So, if you have benefits in 2025 and you don't actively enroll during the enrollment window, you will not have coverage next year. If you don't plan to enroll in health benefits through Brand Safeway, you're still encouraged to log in and designate your beneficiaries. To complete your enrollment, you'll just log in at brandsafewaybenefits.com. Now, we know this might not be a site that you access frequently, so to make it easy for everyone, your password to the site will be reset the day before open enrollment begins. So that means when you go to complete your enrollment, your password will be your birth date in the format shown here. That way, there are no barriers to you getting the info and access to the site that you need. Now, let's get into the open enrollment highlight. First, we're going to take a look at what's changing. Now, in 2026, we're thrilled to be able to offer $20 teledoc visits. That will be your total cost for the visit, even if you haven't yet met your deductible. Now, the $20 visits are true for general medical, dermatology, psychology, and even psychiatry visits if you're enrolled in the CDHP plan. We also have expanded preventative services for women's breast health at 100% coverage. That means if you go to your preventative screening and your doctor orders a follow-up test, that will be covered as well and treated the same as your free preventative services on the plan. Now, we're continually taking steps to reduce the impact of national inflation. That's about 6 to 8% each year for our employees enrolled on the Consumer Driven Health Plan, or CDHP. In 2026, Brand Safeway will absorb most of the cost increase, but there will be a change in premiums for the CDHP, and there will be an increase to our CDHP deductible. However, I'm pleased to say that our deductible remains among the best in our industry. So next, let's talk about what's staying the same. All of our vendor partners and benefit plan offerings, including empirics for prescription medications, will be staying the same next year. You'll still have access to great tools and resources like quantum healthcare coordinators and Lantern to help make sure you're getting the very best care. And you'll still have two great ways to save money on your healthcare next year in 2026. If you contribute to your health savings account, or HSA, Brand Safeway will match your contributions dollar for dollar up to $250. If you have family enrolled on your plan, that maximum goes up to $500 per year. You can also earn a discount on your CDHP medical premiums, but completing the biometric screening. Now, that discount is $1,500 each for yourself and your enrolled spouse. Don't miss out on this free money. So, what's next? Whether you plan to enroll in coverage for 2026 or not, we'd really encourage everyone to log in and complete their 2026 enrollment from October 30th to November 14th. Now, remember, this is an active enrollment, so you have to take action during that open enrollment window, or you will not have any healthcare benefits through Brand Safeway in 2026 unless you have a qualifying life event. Now, in order to make informed decisions during open enrollment, it's important to understand how our health plan works and what options you have. Brand Safeway offers something called a consumer driven health plan. We'll refer to this as the CDHP plan. Now, we'll get into more detail about the ins and outs of the CDHP, including your costs and deductibles. But the purpose of this slide is to help you understand how Brand Safeway contributes to your healthcare costs. Now, Brand Safeway, like many other large US employers, have a self insured medical plan. That means that Brand Safeway is actually paying for all of the healthcare services incurred by our members after the members' cost share. So once someone hits their out of pocket maximum, Brand Safeway actually picks up all those remaining costs. And that's true whether it's a small charge or $1 million claim. Now, when we're talking about the cost of healthcare, it's important to know that inflation has hit healthcare especially hard in recent years. The green line here shows inflation of medical care services, and the blue line is all other goods and services. Now, that inflation is expected to continue, and Brand Safeway is committed to focusing on steps to maintain that affordable coverage for all of our employees. So, when it comes to managing those healthcare costs, we really are in it together. Now, to help combat those increased costs, Brand Safeway is continually working to negotiate the lowest costs and the best access to care for you. We have great resources like our quantum healthcare coordinators who can help you find high quality, low cost options for healthcare. For the last 2 years, Brand Safeway has absorbed 100% of the cost increase that has hit our plan due to inflation. This year, we are sharing a small amount of that cost with our employees in the form of a slight premium increase, but Brand Safeway is still taking on the majority of the cost of that inflation for 2026. We also have financial incentives in the form of medical premium discounts for those who are committed to being tobacco free and for participating in the biometric screening program. For 2026, we will continue to have one medical plan, the Brand Safeway Consumer Driven Health Plan, or CDHP, with a Health Savings Account, or HSA. So now let's take a closer look at that CDHP plan. The CDHP is a deductible first medical plan that is paired with a health savings account. This gives you more control over how you spend money on your healthcare. Now, with the Brand Safeway CDHP and HSA, you may see any provider. However, you'll save the most on out of pocket costs when you see an in network provider. Out of network providers will typically cost you more money. Now, let's look at the chart on this page. The first line in this chart is the annual deductible. Until you meet your deductible, you pay 100% of the Aetna contracted rate of healthcare and prescription drug costs. In 2026, the individual deductible is $2,500. Now, once you hit that deductible, the plan will pay 80% of your covered expenses, and you only pay 20% until you meet your out of pocket maximum. Now, the out of pocket maximum is $4,500 per enrolled person in 2026. Once you meet that, the plan will pay 100% of your covered expenses through the end of the plan year. Now, if you have a spouse and or children on your plan, that will work a little bit differently. So the family deductible on the CDHP is $5,000. You can think of this deductible kind of like a bucket where the costs from all family members are poured into the same family deductible bucket. Now, once you hit that family deductible, the plan starts paying 80% of the costs incurred, and you are only responsible for 20% of your family's coinsurance. Another important thing to note is that in addition to the family deductible, individuals on the family plan have their own individual deductible as well. Now, the IRS does set a higher limit for these individual deductibles that are embedded in a family plan. Because of that, the individual deductible on the family plan is $3,400. So that means if one person in the family reaches $3,400 in claims, the plan would start paying 80% for any future claims for that person only. If the larger family bucket reached $5,000, then the whole family would be considered to have met their deductible and the 80/20 coinsurance would kick in for everyone. Now let's take a look at the cost of the medical plan. Keep in mind there are several factors that are used to determine your specific medical plan premiums. Your coverage tier, so that's if you enroll in employee only or if you have family on your plan, your annual salary, and whether you are receiving the wellness and tobacco-free credits. Now, this slide shows the medical plan premiums for 2026 with both the tobacco-free discount and the biometric screening discount applied. And as I mentioned earlier, there is a slight increase to medical plan premiums for 2026. But keep in mind, these rates on this screen here are the monthly rates, not the per pay period amount. So this slide shows the full amount without the wellness and tobacco-free discounts. So be sure to pay attention to the questions during your enrollment that ask about your wellness and tobacco-free discount participation, and really make sure you take advantage of those incentives. As you can see on this slide, there's a definite cost benefit to taking care of your health. Now, prescription drug coverage is included with your CDHP medical plan. In 2026, Empirics Health will continue to be the pharmacy benefit administrator for the plan. If you're new to the plan in 2026, you'll want to be sure to present your new ID card for your first prescription in 2026. Now, since the pharmacy benefit is included with the medical plan, it is subject to the same deductibles and plan rules. Now remember, with the CDHP, you pay the full cost until the deductible is met. Once you reach that deductible, the plan pays 80% and you pay 20%. That being said, there are some preventative medications that are available at zero cost right away, and some that bypass the deductible. So keep an eye out on those. And for a full list of medications, you can visit the website or look at the guide. Now, we've talked a lot about deductibles and how that works with the CDHP plan. One really important thing to know is that preventative care is not subject to the deductible. That means it's covered at 100%, even if you have not yet met that deductible. So you pay nothing when you see your in network primary care doctor for your annual preventative visit. If you talk to your doctor about a health concern during your preventative care visit, any tests to diagnose a health problem are not considered preventative care. Tests, labs, and treatment for that condition would be covered the way your plan covers care when you're sick. So, what exactly is considered preventative care? Preventative care is the routine health care you get to help you stay healthy and catch problems early before they become serious. It includes things like your annual checkup, vaccinations, and doctor recommended preventative screenings for things like cancer, diabetes, and high blood pressure. Preventative care for children also includes well baby and well child care visits, plus childhood immunizations. Now, getting regular preventative care is really one of the best ways to stay on top of your and your family's health. Plus, having a doctor who's familiar with your medical history can really be beneficial should you need medical care in the future. Now, if you do need medical care, it's really important to understand your options. Now, based on the type of treatment you need, going to the appropriate level of care could really help you save money. One of the most affordable options for care is Teladoc. This is a virtual care platform that's included with the CDHP. And like we mentioned earlier, is only $20 a visit. Now, Teladoc is appropriate when you have mild symptoms like a cold, the flu, maybe a sore throat, or minor skin issues like a rash or allergies, or if you need mental health support. Sometimes going to an in person visit with your primary care physician or PCP is a better option. It's also typically lower cost than urgent care or emergency care. Now, because your PCP knows your medical history, they are the best for routine checkups, annual physicals, and managing chronic conditions. Urgent care is another great option when you need prompt attention for non life threatening issues, and maybe you can't get in to see your doctor. Urgent care is usually more affordable and has less wait times than an ER. And finally, going to an emergency room is for very serious or life threatening situations. Now, if you're not experiencing an emergency and time allows, you can always call your care coordinators to help you determine the best level of care for you and even get help finding an in network provider. So, next, I want to share a bit more information about Teladoc since it's such a convenient and affordable option for care. Teladoc offers remote 24/7, 365 phone, video, and mobile app access to medical consultations with board certified physicians. A doctor can even prescribe medication, if medically necessary, to the pharmacy of your choice. Now, in 2026, IRS regulations will now permit companies like Brand Safeway's plan to provide Teladoc at a reduced cost share to you and your covered dependents, pre-deductible. So in 2026, again, visits will only be $20. Now, for those enrolled in the CDHP, Quantum Healthcare Coordinators are really a one-stop shop to help you navigate your healthcare. Think of them as your personal healthcare guides. They're nurses, clinicians, and benefit specialists who take the time to get to know you and your family's unique health and wellness needs. So they can work with your providers. They can help you make sure you get the best possible care. Now, your quantum healthcare coordinators are not your typical benefits help center. You will receive personalized one on one care from an expert team. Quantum healthcare coordinators can help you with things like answering questions about your benefits plan and wellness program. They can help you find an in network primary care physician. They can even ensure you obtain and properly complete any pre certification requests and help you understand your claims and invoices and how you might be able to save money on out of pocket expenses. Another great resource we have is Valen's Blue Book. Now, this was previously branded as Healthcare Blue Book. And this is a tool that uses simple green, yellow, and red symbols so you can easily see which facilities charge a fair price and which ones don't. You can shop for outpatient and inpatient procedures, as well as tests and diagnostic imaging. Now, Valen's Blue Book also provides detailed information on the quality of common inpatient procedures. Now, an inpatient procedure is something that requires a hospital stay. It will also help you to easily identify and select a facility that has a high quality rating. You can even use the search doctor quality tool and earn rewards. And when you use that tool before certain procedures, you can get those rewards and it really adds up. Now, one more program available to our CDHP enrollees is called Lantern. Now, enrollment in Lantern is included with your medical plan at no additional cost to you. Lantern is a benefit that is really designed to help employees and their families with accessing that high quality, cost effective care for non emergency surgery. You'll have a dedicated surgery advocate that will help you coordinate consults and really just find the best providers. Now, when you're using the Lantern program, your coinsurance is waived. So that means you're going to save significantly on your procedure. You're also provided with a preloaded debit card to help you pay for things like gas, meals, and parking expenses prior to your appointments. Now, just as a note, this organization was rebranded in 2025. It used to be called Surgery Plus, and next year it will be called Lantern. So you will see that branding on your new ID cards for 2026. Now, on the next few slides, we're going to take a closer look at the programs available to help you save money on your medical plan premiums. The biometric screening program gives you two options to earn significant discounts on your medical plan premiums. Option one is to see your doctor in person to get a physical with blood work. You just print your physician form and bring it to your appointment. Now, once that's completed, your doctor should email or fax the form using the included instructions. You'll want to make sure your doctor fills out all of the required fields, or the processing of the form may be rejected. Your other option is to get a biometric screening at a LabCorp location. Now, you can easily find a location and schedule your appointments through the Health Advocate site. During your open enrollment session, you'll see a question asking if you and your spouse, if applicable, completed a biometric screening before November 14th, 2025. Selecting yes will let you see the discounted rates for the medical plan. Now, if you were not enrolled in the CDHP in 2025, you will need to register for an account online so that Health Advocate is ready to receive your screening results. If your spouse was not enrolled in 2025 but will be in 2026, you'll need to grant them access to their own Health Advocate account in order for them to receive that wellness discount. If you're in this situation with a spouse newly joining medical next year, simply log into your own Health Advocate account and add your spouse as a dependent. This will prompt an email to be sent to your spouse with a link to register, and they can take it from there to register and download the necessary forms. Now, another way to save money on your medical premiums is by being tobacco free. During your enrollment, if you attest that you are not a tobacco user, you will receive a $500 tobacco free discount. Now, if you or your spouse are tobacco users, you still have an opportunity to earn the discount. We have a tobacco cessation program available to you at no cost through Quantum Health. If you complete the program within 90 days of your medical plan effective date, that discount will be applied retroactively, and any surcharge you've already paid will be refunded. Now, if you complete that program after the first 90 days of the plan, that discount will be applied going forward. Now, in addition to the CDHP, which we've been discussing, employees who reside in the state of California also have access to enroll in a medical plan through Kaiser. Eligibility for the Kaiser plan is determined based on your zip code. So, if you live in an eligible area, you will automatically see the plan during your enrollment session. You can view these details here and lots more information about the plan in the open enrollment guide, or it will also be available during your enrollment session. Now, here's a look at the monthly premiums and pharmacy benefit for the California Kaiser plan. You can take a closer look at this during your enrollment or in the open enrollment guide. Now, similarly to those in California, there are specific medical plans available for employees in Hawaii. Eligibility for these plans are also determined based on your zip code. So if you live in an eligible area, you will automatically see the HMSA plans during your enrollment session. Now, there are two plan offerings through HMSA. One is an HMO and one is a PPO. This slide has details about the PPO offering. Now, there are no design plan changes for 2026. Now, you can view these details and more information about the Hawaii PPO plan in the open enrollment guide or during your enrollment session. And this slide goes over that Hawaii HMO plan through HMSA. Again, there are no changes for 2026 to this plan. Now, for rates and plan details for both of the HMSA plans, take a look at the plan summaries during your enrollment session or take a look at the open enrollment guides. Next, let's take a look at the savings and spending accounts available to help save you money on your healthcare expenses and more. Now, if you enroll in the CDHP medical plan, you also have the ability to open a health savings account or an HSA. An HSA lets you contribute money from your paycheck before taxes to a special account. You can use that money to pay for qualified healthcare expenses. Now, the best part about an HSA, aside from saving money on your healthcare, is that it is not a use it or lose it plan. That means if you don't spend all of the money you contribute in 2026, those funds will roll over into the next year. That's true even if you were to leave the company, the funds are yours to keep. Another great benefit is you can change that amount that you're contributing anytime throughout the year. As an additional bonus, Brand Safeway will match your HSA contributions dollar for dollar up to $250 for employee only coverage or up to $500 if you have other dependents on your plan. Now, this company contribution is a match, so you do need to contribute as well to get the contribution from Brand Safeway. If it's your first time having an HSA with Fidelity, be aware you may be asked to submit some additional information. Now, this is part of something called the Customer Identification Program, or CIP, and it's designed to ensure the identity of the person opening the account. Many of you may pass the CIP right away. If that's the case, you're all set. You'll be mailed a debit card and you'll get a welcome letter, and your contributions will begin to post to your account accordingly. For some of us, Fidelity might need more information. If that's the case, you'll receive an email and letters in the mail, really just detailing those next steps needed to pass the CIP. Once that information is received, your account will be opened and you'll start receiving those contributions. Now, in addition to the health savings account, we also have something called a spending account that can help you save on health care, dependent care, and even commuting expenses. Now, if you're not enrolled in Brand Safeway's CDHP medical plan, you can enroll in a flexible spending account or FSA. Like the HSA we talked about earlier, the FSA is a great way to set aside pre-tax dollars to use on eligible healthcare expenses. Unlike the HSA, which funds each paycheck as you contribute to the plan, the FSA is front loaded at the beginning of the year based on your election. Now, because of that front loaded amount, you cannot change your deduction outside of open enrollment or a qualifying event. The FSA is a use it or lose it account, and any funds that are not used are forfeited at the end of the plan year. Now, if you are enrolled in Brand Safeway's CDHP medical plan, in addition to the HSA, which is that health savings account, you can also choose to contribute something called a limited purpose FSA. Now, this works the same as the standard FSA in that it's a use it or lose it plan, but it can only be used for dental and vision expenses, not medical. You can have both the HSA and a limited purpose FSA together on the CDHP plan. Now, we also offer dependent care and commuter spending accounts. You can learn more about these plans during your enrollment or in the open enrollment guide. As a reminder, spending accounts are use it or lose it by design, so you'll want to be really sure and estimate your healthcare needs carefully. If you have a spending account this year in 2025, this is a reminder that you'll need to spend any of those funds by March 15th, 2026, and any of those claims will need to be submitted by March 31st. So let's take a look now at the dental and vision plan offerings. Brand Safeway's dental plan is offered through Delta Dental. It's a standalone plan, so you don't have to be enrolled in medical to elect dental. The costs here are monthly, so the actual amount you pay per paycheck will be less than this, depending on your pay schedule. Now, similar to medical, the first thing you're going to do is pay your deductible. After your deductible, the dental plan covers 80% of basic services. Basic services are things like fillings, and it also covers 50% of major services. That's things like root canals and crowns. Now, it's important to remember that preventative care services like cleanings and x rays are covered at no cost to you and are not subject to the annual deductible. Next up is vision. So, our vision coverage is provided by VSP. You can use these vision services once every 12 months, and that includes an eye exam and either lenses and frames or contacts. The VSP plan is not eligible for use at Costco, Walmart, or Sam's Club. But to find an in network provider, you can go to VSP.com. Now, one important thing to note is that VSP does not automatically send out ID cards for vision. Most eye doctors don't require an ID card. You just let them know your name. Sometimes they'll ask for your social security number and date of birth, but mostly you'll just let them know you have VSP and the provider will verify your coverage. Now, if you really want and prefer a physical ID card, you can just go online to VSP.com and print that out after you register and log into your account. So now we've covered most of the major plans that come to mind when you think of healthcare. But Brand Safeway has some additional benefits that are so important for you and your family. This next benefit we're covering is life and AD&D insurance. Now, this important coverage is really designed to protect your loved ones who depend on you. Brand Safeway offers company paid basic life and accidental death and dismemberment or AD&D insurance through MetLife at no cost to you. If you want additional coverage for yourself, your spouse, or your children, you can purchase supplemental coverage at our Brand Safeway group rates. Now, if you choose supplemental coverage for yourself and or your spouse, that is higher than what we call a guaranteed issue amount, you will be required to provide proof of good health. This is also known as an evidence of insurability. Now, if you don't complete that EOI or that evidence of insurability within 30 days of your enrollment, that coverage will default back to that guaranteed issue amount. And when you do your enrollment, you'll see that guaranteed issue amount listed. Now, you should expect to receive a communication from MetLife to complete that EOI process. Additionally, MetLife requires an EOI for any coverage that you elect that you previously waived when that coverage was initially offered. Typically, that would mean if when you were a new hire doing your new hire enrollment, if you waived coverage and now you want to pick it up, you might need to do that EOI. Now, Brand Safeway also offers short and long term disability insurance through MetLife. The waiting period for the company provided short term disability is 60 days. Disability insurance is designed to supplement your income when you're out of work for your own medical condition. In partnership with MetLife, Brand Safeway also offers access to voluntary benefits that you can elect during enrollment. These voluntary benefits are critical illness, accident and hospital confinement indemnity insurance, and these benefits provide a cash payment to help cover your expenses if you experience a covered medical event. Again, there's detailed information on these plans in the open enrollment guide. Now, this next benefit you'll see during your enrollment is legal insurance. This is administered by ARAG. Legal insurance provides people with the help they need to address and resolve legal matters. That could be things like a traffic ticket, landlord disputes, or even family matters like marriage, divorce, child custody, and adoption. They can also help with things like buying or selling a house, debt issues, and much more. We also have identity protection. This is administered by Allstate. Now, with this plan, Allstate will assist with credit and dark web monitoring to protect you from identity theft. In 2026, there are some new enhancements for cyber protection, but your rates will remain unchanged from 2025 to 2026. Now, we've talked a lot about health benefits available to support you and your family. But another really important aspect of your overall well being is your financial health. Brand Safeway employees have access to Fidelity financial resources where you can receive personalized help with taxes, college planning, and more. Fidelity also administers Brand Safeway's 401k plan. Now, contributing to a 401k is a great way to save for retirement and plan for your future. You have the ability to make contributions pre tax or after tax into a Roth account. Brand Safeway provides a matching contribution to your 401k. Now, to take advantage of the company match, you would want to contribute at least 5% to receive a 4% match. Now, you can update your contribution election at any time throughout the year at netbenefits.com. Now, this next benefit is so important, and I really hope everyone remembers this if you ever have a need. The Employee Assistance Program, or EAP, is available to all Brand Safeway employees and your family members. So that means you, your spouse, your children, and even your parents and in laws can use this benefit, even if you're not enrolled in medical insurance through the company. Now, the Health Advocate EAP gives you access to 5 free counseling sessions per year at no cost to you. This could be in person with a local provider or virtually, really just depending on your preference. You can get help dealing with things like stress, grief, financial issues, and more. The services are completely confidential and free of charge. Now, you can learn more and get connected with a provider at healthadvocate.com/members. Now, if you or a loved one are nearing retirement age, navigating Medicare can be such a daunting task. Brand Safeway is happy to offer a free resource to assist you when you have questions. It's called Smart Connect, and it's a partnership that is an exclusive, no cost program created specifically to connect Medicare eligible working adults to the world of Medicare. Now, whether you plan to continue working or if you're transitioning to retirement, Smart Connect is able to tailor these solutions designed around your needs. They have licensed agents that provide an unfiltered view of the entire range of options and prices available to you, your family members, and your friends. Now, there's no cost to connect with Smart Connect and no commitment if you connect with them to move on with the process. Really, it's just there to help you get that helpful information that you need when you need it. Now, the last benefit we have to highlight before we get into some important open enrollment reminders is the employee discount program. Now, this program is administered through Workday Advantage, and it gives you access to great deals and discounts on entertainment, travel, and much more. Just one of the many offerings through the discount program is something called Active and Fit Direct. Now, Active and Fit Direct offers access to over 8,000 gyms in the US, with rates starting at as low as $28 per month. Now, you'll need to access Active and Fit Direct through our intranet in order to be identified as a Brand Safeway employee and receive the discounted rates. Now, last but certainly not least, let's get into some important reminders about benefits open enrollment. Now, we looked at this slide near the beginning of the presentation, but I want to show it to you one more time. The biggest thing to remember is that we have an active enrollment this year. So your benefits do not roll over automatically, and you have to take action to enroll or waive coverage. And you're going to do that at brandsafewaybenefits.com. To make sure that you're up to date on important benefits information throughout the year, while you're in there during your enrollment, you might consider opting into text messages to get the latest benefits news straight to your phone. You can do that on brandsafewaybenefits.com under My Profile. And if you need to update your contact info, like your phone number, you'll do that in Workday, and it will flow through and update the benefits system as well. Now, the next two slides have some important contact information for all of the vendors involved in our benefits program. This information is available on the benefits page on the company intranet, as well as in the enrollment guides. Now, this slide is really important. Make note of these critical dates tied to open enrollment this year. As we discussed, your password for brandsafewaybenefits.com will be reset on October 29th. Open enrollment runs from October 30th to November 14th, and new ID cards will arrive to you by January 1st. Also, as a reminder, if you participated in the flexible spending account in 2025, your deadline to submit any outstanding claims from this year is March 31st, 2026. Now, I know we went over a lot of information today, so if you want to take a closer look before open enrollment begins, all of this information and more is on the benefits section of the company intranet and in the open enrollment guides. Now, it looks like we do have some time left. So if you have any questions, go ahead and put those in the chat now, and we'll get to as many as we can. We've got some other members from the benefits team here that are going to help us out with that as well.
Hi, Margot. We've generally been keeping up with all of the questions in the chat, so I think we've had a ton of activity in the chat and a lot of great feedback that we have responded to, and also can take a few things back and check into for some of our employees. And but right now, I think we're pretty much up to date, and I will just respond to this last question here. So as Margot mentioned, if anybody has any other questions, please do put them in the chat so that we can help address anything you've got. And, you know, if you've got anything that is more of a personal issue or question, please do reach out to one of us, or submit a Workday help case, and we can help work through that for you.
All right. Well, if there are no questions, I want to thank you all for joining. Thank you, Anne Marie and Kelsey, for helping with the questions in the chat. Oh, Candace, I see your question. How do I submit the year-round biometric? So there are instructions to submit your biometric screening. Kelsey, do you want to take that one since you're a little bit more knowledgeable about that? Or Anne
Yeah.
Marie?
Yeah, for sure. So you would submit it, which you complete the form, and then you would provide it to Health Advocate. I'll send over the instructions to you. I'll just drop the link in the chat, but there's a full process depending on the way that you want to do it. So you can go for it that way.
Perfect. Thank you, Kelsey. And that'd be great. We'll put it in the chat because I'm sure lots of people are realizing that the time is upon us to get those biometric screenings in. Let's see. Can you explain more about annual deductible 3,400 versus individual deductible? Yes, absolutely. So if you're enrolled in employee only coverage, it's just you on the plan, your deductible is $2,500. When you have more people on your plan, your family deductible is $5,000. So if as a family collectively you reach that $5,000, then everyone on the plan is considered to have met their deductible. If one person on the plan reaches $3,400, that's the individual deductible on the family plan, then that person would start having that 80/20 coinsurance, but the rest of the family would still pay 100% until they meet their deductible or that $5,000 collectively is completed. Now, the reason that it's 3,400 instead of 2,500 for the family plan is due to IRS regulations. Hopefully that helps. Any other questions? And remember, you can always reach out to us or put in a Workday help case as well, and we're happy to get back to you.
All right. I think we're good, Margot, and we can continue to address any questions in the chat
Sounds
as folks put those in. Um, I do see one question that's an important one to just mention to the group. The biometric screening discount is all about participation. It has nothing to do with what the actual results are. In fact, Brand Safeway does not see any results for anyone. It really is just about you knowing your numbers. We don't need to know your numbers. We don't want to know your numbers. We just want to know that you have completed the process, and that is what we use to apply the discount, is just a check mark that you completed it. And username on Health Advocate, it's you may have to go through a process of forgot your password and re-establish a password, a username and password process there. And I believe they implemented multi-factor authentication, so hopefully you can get established there. And if you have issues, there's a phone number for Health Advocate, and they can help you get reset on their website as well. The Brand Safeway code, just try typing Brand Safeway.
Jennifer, there's a specific guide that is for California employees. So make sure you're looking at that version if you're looking for information on Kaiser.
And we will send out this slide presentation along with the recording to those who attended. And I think we do actually post the recording to our benefits SharePoint page. So you all will have access to all the slides as well.
All right. Well, thank you so much, everybody. We'll give you a few minutes back in your day. And again, feel free to send us any questions. And thank you for joining. Bye, everybody.